I just wanted to talk a little bit about Metro's pricing transparency and the history. As I mentioned, since 2006 at least, we've been publishing our rates. And basically, we've added in 2013 payer links so that our patients could actually go to our own website, and based on their insurance, they could tap a link, and that would take them right to their insurance portal so that their own insurance company could provide them with an estimate. We did it through our own website because we felt that it's very difficult to navigate through many of the payer portals, and we could provide guidance to the patient when they're in their own portal as to how to access it, what they're actually looking for, possibly define different type of insurance jargon, et cetera, that we may be accustomed to, but the patients are not. We also discussed expanding our own estimates, not only to patients, but also to consumer advocacy groups like AARP and also senior citizen groups. And we started to get quite a bit of shoppers in 2013. Although we are an essential hospital and we're in Cuyahoga County, we actually get international shoppers who may be moving to Ohio, and they're actually looking to deliver their children here. So they're looking for what are the gynecology and what are the OB and the delivery pricing, in addition to some other things that Metro's very much known for. In addition, another venue that we use are letters to our Medicare patients so that they can see, on average, what our visit charges would be to see the provider, and also certain procedures that seem to be those that are most frequented by our Medicare patients. And this provides them information before their visit so that they can reach out to us with any questions. It also allows us the opportunity to talk to the Medicare patient to ensure that they may have enrolled in Medicare Part B, or if they've chosen some other secondary insurance. Oftentimes, Medicare patients don't realize that they need to enroll, nor that there's a cost associated with it. So we can facilitate with financial coordination. And then, of course, as Beth mentioned, the traditional patients may call us, our pre-service center, and we give estimates by phone. And then we always confirm with a letter to our patients. So again, we have very many ways in which a patient or the consumer can contact us regarding patient estimates. And then on slide 12, in order to be able to accomplish this, we feel it's very important to provide certifications and education for our staff so that the community understands that we do have experts in the field to facilitate providing estimates, providing financial coordination, and able to reach out to our community and patients so that we can be knowledgeable and feel confident in the information that we give them. We basically, when ACA started in 2014, we have a total of 38 staff that are actually certified application counselors. In addition to those staff prior to that, we're all certified hospital access associates, and all of our managers have the NAHAM certification for hospital access also. This allows our staff and professionals to feel confident about the information that they're providing, and our patients and community to feel confident about their information they're getting to remove any financial barriers. We also moved out in the community with slide 13 to become much more proactive and move away from we're just providing our patients information about pricing transparency and estimates. And we were very fortunate that we had a 38-foot RV at the hospital that was being used for other programs, but it wasn't being used on a regular basis. So probably about 3 months out of the year, it would be on the road for clinical services. So what we did is we actually collaborated with the other programs, and we turned it into an enrollment vehicle on wheels. So instead of concentrating just on our sites where we had financial coordination and ways to get patients assistance with either enrolling in insurance or financial programs, we literally staffed this RV, and we staff it probably about 95% of the year, even in the wintertime, as long as weather permits, so that we could educate patients on preventative care, continuity of care, and how they should not be concerned about not having coverage, because that's what we're experts to do, to navigate them through healthcare exchange, Medicare, Medicaid, and other financial programs that they may be eligible for, including financial assistance. So basically, since March of 2014, when we launched the RV, we've literally assisted 4,000 people, and we were able to enroll 70% of those individuals in insurance programs. New patients to us who we didn't have before the RV, we probably run at about a 10% enrollment of brand new patients. This helped us provide preventative care and have a healthier community, but it also helped us with reducing expenses because patients' acuity levels were lower going through preventative care, and it reduced the emergency visits that we were seeing. So we were taking care of the community as well as managing our expenses appropriately. Then basically, we made sure that everybody understood, because you know you always have statistics, that really all of these numbers are about people, and it's about making a difference. And we saw that in our programs, we really were able to manage population health because we were managing diabetes and other acute care that was needed, and helping people truly understand by modifying their lifestyles, by seeing a physician earlier, by having medical management right there for them, that it's not just about navigating their financial care, but also navigating their clinical care.